a psychiatrist at Belize Medical Associates, and today we will be discussing the topic of mental health. Mental health includes our emotional, psychological, and our social well-being. It can affect the way we feel, the way we think, and the way we act. It also determines the way we relate to each other, the way we manage stress, and how we make decisions. Everyone can suffer from some form of mental illness at any stage of life. So maintaining healthy mental health is important, not only in childhood, but also adolescence and up to adulthood. Mental health can be affected by several factors. We like to divide them into three categories: biological, psychological, and environmental. Biological factors look at your genes, which talks about your genetic makeup. If you suffer from any illnesses, chronic or degenerative diseases, and terminal illnesses. In children, we're looking at factors like malnutrition, which can all affect your brain health and in so doing affect your mental health. Psychological factors look at your personality trait, your upbringing, the way you see yourself and you look at the world. If you have suffered any kind of adverse events in your lifetime, or if you are living in or have suffered from any form of abuse. Environmental factors look at things like poverty or financial situation, employment or not. If you are dealing with any form of grief or adverse situation at that point in your life, all these things can trigger mental illness. What are early signs of mental illness? We are looking at changes in your sleep patterns. You could be sleeping less or excessively. In your eating patterns, you may be eating less or excessively. Changes in your mood. You will notice that there will be extreme mood swings. And as I go mentioning other symptoms of mental illness, I want you to think of it as a volume control, which there's a range where normal people are, and anything which varies either above that or below that can categorize as mental illness. We're looking at aggressive or agitated behavior. So if you find that you are fighting or arguing with family members and close friends more frequently than not, it may be signs that you are suffering from mental illness. Abusing substances like alcohol, marijuana, cigarettes, etc. can also be signs that you are dealing with extreme stress, which may be part of mental illness. If you are hearing voices or perceiving through your five senses anything that nobody else is perceiving, they may also be signs of mental illness. Other very important symptoms of mental illness is having negative thoughts, thinking of harming yourself or harming others, and other uncommon symptoms are difficulty with memory, concentration, and planning. The absence of mental illness does not necessarily mean that someone is mentally healthy. So what do mentally healthy people look like? These are people who are able to understand themselves, their emotions, and can clearly communicate this to others. Being able to listen empathically to what others have to say, looking at the differences and being able to relate and understand that. And if you are able to cope with stresses of life, these are contributing factors to your mental health. The World Health Organization defines mental health including 4 aspects of it, which is reaching your full potential as a person, working productively, managing stresses of life, and making meaningful contribution to your community. Now, you may be thinking of how you can maintain your own mental health, and I have several tips for you. One of them is staying connected. Ask for support when you need it. There's no shame in asking for help. Staying active. Make sure that you find some form of physical activity to engage in most days of the week. Making sure that you have regular structured sleep patterns. It helps to go to bed at the same time and waking up at the same time every day. Making sure that you are also doing things that make you feel good. So take time to play if you are a child, and making time for creativity if you are an adult. Healthy stress management and learning how to problem solve also contribute to maintaining your mental health. Unhealthy coping mechanisms are avoiding the situation or the person who you believe is a trigger, using alcohol or other substances, overeating, oversleeping, overspending, or maybe venting to the wrong person repeatedly. Engage in hobbies such as gardening, drawing, painting, crochet, embroidery, playing sports, staying outdoors, and just do more of the things that you like. Now, if you are wondering at what point you should seek professional help when experiencing symptoms of a mental health disorder, then generally the right time is when you are having difficulty coping with daily life activities such as work, school, and relationships. Your mental health professional may be a counselor, a psychologist, or a psychiatrist. I am a psychiatrist, which means I am a medical doctor who specializes in the diagnosis and treatment of mental illness. And mental illnesses can be treated with medication or psychotherapy. If you or anyone you know are suffering from symptoms of mental illness, give us a call at BMA. Let us help you get your life back on track. Because here at Belize Medical Associates, we do care.
BMA, Belize Medical Associates, they'll see you.